Hello all, I'm Dr. Karthika from Department of Biomedical Engineering, SNS College of Technology, Coimbatore. Today we are going to discuss about medical imaging modalities part 3. In the previous videos of medical imaging modalities part 1 and part 2, we have discussed about almost all the medical imaging modalities like CT, MRI, digital fluoroscopy, digital radiography, ultrasound imaging. And in this part 3, we are going to discuss about the remaining medical imaging modalities which is mainly used for specific biomedical applications. First one is nuclear scintigraphy. Actually see the nuclear scintigraphy image. This is our nuclear scintigraphy machine. With the help of this, we can get the imaging of our internal organs. And how it works means patients are injected with a short-lived radioactive isotope which travels to a specific organs and tissues, and which is mainly used to identify lameness in equine patients where the cause of lameness is difficult to localize by conventional methods. It detects portosystemic shunts, subclinical renal failure, and hyperthyroidism. Evolution of mucociliary clearance also identified with the help of this scintigraphy. And we have some risk, like the patient is administered radioactive element called isotope or tracers that go through the bloodstream to the target organ. Patient is usually isolated 12 to 24 hours after the exam to allow the body to become clear of the radioactive traces. Second one is endoscope. Here, a small camera is guided throughout the body via naturally existing orifices like nose, mouth, etc. It can reach most parts of the body without the need of open surgery. And it has many uses like observe internal structures without surgery. It can assist with diagnosis at minimally invasive surgeries, which is mainly used in minimally invasive surgeries, biopsy. And types of endoscopy, we have gastrointestinal tract, also we have respiratory tract. With the help of that, we can get images of small intestine, large intestine, rectum and anus. Also we have nose and lower respiratory tract. Also we have urinary tract, female reproductive system and closed body cavities. With the help of endoscopy, we can get the images of our internal organs. And we have some risk, like a patient is usually anesthetized and complications like such as perforation of organs due to the exam rarely occur, but we have to give anesthesia to the patient very particularly, and tearing of tissue may require surgical repair too. And we have electrocardiograph. Actually, how it works means patient lies on their right side. One thing in the previous video I've said, it is the medical imaging modalities. It is normally used for humans as well as animals. In case animals means they can lie on the right side as like humans, or it can stand by themselves. And a conductive gel or alcohol is applied to the skin to better transmit the electrical activity, and a clip or plate electrodes are attached to the pets in case of animals, pets limbs and chest wall, which are attached to the thin lead cables connected to the machine. Typical recording duration is 30 seconds to 2 minutes only. And uses, we have some uses like it reveals the abnormalities of heart rate and electrical rhythm, and the screening test for serious heart disease, but it should be used in conjunction with the stethoscope exam, chest x-ray and echocardiogram. And we have radiograph. Radiograph produces by transmitting x-rays through a patient's. X-ray pass through a less dense objects, fluid or air, and are absorbed by a denser object's bone. A captured device converts X-rays into visible light, which then forms an image. Denser objects like bone appear white, while less dense objects, air or fluid, appear black. And while coming into uses, it is used to examine and diagnose internal structures such as bones, heart, lungs, and abdominal organs. We have to take some safety and risk measures like radiography is painless. Sedation may be needed to reduce stress and properly position animals and humans. Technicians restraining patients must wear protective apparel and monitor exposure. That is the main thing, and we have to maintain a radiation safety, control exposure levels by maximizing the distance from radiation source and minimize the radiation exposure time, proper shielding for radiation source and proper shielding for personnel required, and personnel staying in the exam room should be protected by proper shielding. And we have some thyroid shields, leaded glasses, gloves, and aprons. Thank you. I think we'll get a clear understanding about medical imaging modalities in this part 1, 2 and 3 videos. And in this May 2024 lecture video, we'll discuss about from the scratch of image processing to the end biomedical applications, from Fourier transform to the medical imaging modalities in biomedical applications. Thank you.